Good evening, ladies and gentlemen, wherever you're watching us from. Good evening, good afternoon, good morning. Tonight, I have with me a sister, a friend, all the way from Minnesota, the United States of America, and we'll be speaking on the topic leadership and vaccination. Leadership and vaccination. Um, can you just introduce yourself, please?
Okay. Good evening, good morning, good afternoon. My name is Omotola Akishete, and I'm from Nigeria. I was born in Lagos, went to medical school at the University of Lagos, and I did my residency in Rhode Island in internal medicine, and then went and did a fellowship in infectious diseases at the University of Minnesota. And I am an associate professor at the University of Minnesota in infectious diseases. I am the chair of infectious diseases at Health Partners Medical Group. And I have a specialty or a special interest, if you will, in HIV and AIDS, especially in African Americans, Africans, and other people of color.
Wow, that's quite fast, you know.
I know. I can definitely slow down.
I think I need to give you another opportunity to say it again so that you know.
Well, there are a couple of other things I could add in there if you.
Okay, just add some, you know, so that you know. Yeah, but you know, I just want to say you're wonderful. Yeah, I just want to welcome you and salute you for showing up tonight.
Thank you very much, Okay. I'm always so fast in introducing myself because I feel as though people are trying to listen to what I have to say. I don't necessarily know who I am, but I am very flattered that you want to introduce me. I can add a couple of things, like I said. I After medical school, I went to the Caribbean. I was in Trinidad and Tobago. I did my internship there for like a year and a half, and then I went on to do a master's in public health at the Johns Hopkins University in Baltimore, Maryland. I worked at Howard University and the National Institutes of Health as a research associate before I went to do my internal medicine residency in Rhode Island. And then, of course, I came to Minnesota to do my fellowship, and I got very, very interested in the world of HIV and AIDS because at the time I was finishing my residency was when we started to get good medications to treat HIV, and all of a sudden, HIV was not not a terminal disease for people anymore, and I was very interested in getting into that realm, into that fight, especially meaning that we noticed that the infection, the epidemic, if you will, was exploding in Africa at the time. So I've always been very interested in infectious diseases and in teaching, in educating my fellow, individuals, especially people who are African American, people of color, people from Africa, and it's just been a passion of mine, and I've been enjoying it.
Wow, Bosola, I just want to say I celebrate you. I salute you, and I just want to thank you for showing up at a time like this. You'll be speaking to something that is very sensitive, a topic that is very sensitive all over the world. Vaccination, with COVID, so many things have happened. There's been a lot of disruption, and particularly countries in Europe are still going through, the challenges. In the US, I know that that Friday, we've had, a little over 20% of the population has taken the vaccination. In the UK, the numbers, obviously, they've done much more than Europe and the US. I want to ask you, how did you get into leadership?
Okay. I actually didn't plan on being a leader in that sense. When I first started off, people will know me from school and my family. I've always been very independent. I want to do what I want to do, and based on my mentorship for my parents, I felt I didn't have to conform to what everybody else was doing. I didn't have to follow the regular route. So I wanted to make my own way in life. I didn't want bureaucracy. I wanted to just do what was of interest to me. And that's why, I've traveled, I've gone to different places and done a few different things in terms of my career. Um, I focused on my career a lot for the first, almost 40 years of my life. And then I got married, a little late and focused a little bit on my family and, raising a family. And I stepped back a little bit from the world of, research and just being out there as this, high flying infectious disease doctor, because family is extremely important. And my kids were extremely important to me. So I took a step back and then decided to sort of refocus myself and try to figure out what I wanted to do next.
Yeah.
This opportunity came and I thought it was just a natural fit for me. I've been in the world of infectious diseases for a while. I had been in the organization, Health Partners, and for a while, and also had been in the academic world as well as working in a county hospital. And I come from another country. I'm an immigrant. I'm an African. I'm a Black woman. I figured, I like challenges. I want to do something for the good of other people. There are a lot of things that I see that can be changed, in all these aspects of my life that I just mentioned. Being a Black person in the United States, being a woman, being an immigrant, being an infectious disease doctor, even being a mother, there are many different things that we could do to inspire other people and to make it work for other people. So I figured that this was the way in which I could get out there and actually try to help, if you will. And that's how.
I just want to thank you so much, because I know your schedule is very hectic. Because the numbers are also rising in the US in terms of COVID. If I'm not, out of place, I know that is it about 80,000 a day or 70,000? The numbers as at Friday,
Yeah, they're going up. They're definitely going up all over the country. I mean, when I even look at some small numbers, Minnesota is one of the places that the rate has ticked up. At the beginning of January, I thought that, or towards the end of January, I thought, well, maybe we were getting ahead of this epidemic, and we didn't have so many people in the hospital, but things have ticked up again. We have many, many people in the hospital. And these people are younger, they are not as old as the people who we had initially. So the numbers are going up again. We have this variant that's out there that are more transmissible. We have, people who are tired of being in lockdown. They're tired of wearing masks. They're tired of not seeing their family. The weather is getting better. And so people are not everybody is adhering to the mitigation attempts in terms of public health. So we're seeing those numbers rise again. It's a bit disconcerting and disappointing because of all the work that has been gone into trying to get things to this point, from the different people, researchers, education, doctors. But we just keep trying, I'm hoping the message gets through.
I just want to jump in and just thank you for, your service, what you've been doing, since March 2020. I mean, the world has gone through a major disruption, and particularly for, people like you that are doctors, you're in the midst of everything. How has it been, coping? I know you also, went through your own challenges in the midst of all this COVID. Can you speak to that, please?
Yeah, it was very challenging actually. When this came about at the beginning of last year, we were thinking that it wouldn't be so severe, but obviously, we're thrown into a global pandemic, and America got it really bad, if you will. Our numbers soared very, very quickly. And we were called upon, especially infectious disease doctors, critical care doctors and heads of different organizations, to try and get some guidance in place, look through all the research, what medications can we use, what are the different symptoms of this disease, how is it spread, what kind of public health messages should we get across, what kind of research can we do. And at the beginning we've never seen this virus before, right? This virus is totally unique. So there was so much we didn't know about it. And there were all the medications. I don't know if you remember hydroxychloroquine that came at the beginning. I was touted by some people, and we had to debunk that. And there were many different medications that were tried and didn't work. And we were seeing people die every single day. The numbers were terrible in the hospital. We were so busy. Would get home at night at around 10 o'clock and then get to work again at around 7 something in the morning. Hardly saw my kids. And then I got infected. My whole family got infected in, I think it was in June or so of 2020. And, I felt very, what's the word, guilty. Because initially I thought, well, was it my husband? Did he go to a grocery store and didn't put on a mask or wear gloves? But at the end of the day, it only makes sense that it was that somewhere or the other, I brought it home. And I felt extremely guilty. I made sure that my husband and my mother-in-law, who had been staying with us, they had it a little bit worse than I did. So I had to look after them and then look after myself and look after the children. My two children they had the disease as well, but they were asymptomatic. And so between looking after the kids and taking care of myself and taking care of other people and still trying to work, it was a major, major challenge. I don't know how I did it, but
thank God you're here.
Thank goodness.
Wow. Because I just want to speak to that, because it's not for you just to come and encourage us, but also to let you know that we also appreciate what you're doing, and also your colleagues all over the world that are making sure that people are taken care of, and we just want to celebrate you. Now, how important is vaccination? How important is it?
Now, you're talking vaccination for all diseases or just for COVID?
For COVID. I mean, I want to focus on COVID now, but you can expand it if you wish.
Okay. Well, vaccination in general is extremely important, extremely, extremely important. And we who come from developing countries see infections every day, preventable infections, preventable deaths. I remember being in medical school and trying to, use an ambu bag to try to bring oxygen into the lungs of this little boy, baby who had tetanus. He hadn't been vaccinated. His mother hadn't been vaccinated. And we had to take turns because we didn't have a ventilator. And of course, the baby died at the end of the day. There are so many preventable diseases that people died of. And that's actually what got me interested in infectious diseases in the first place. And so now that we have so many vaccines and people are living longer, not just in the developed world, but in the developing world as well, we shouldn't forget that there's a reason why vaccination came about in the first place. These organisms, microorganisms, some of them, parasites, some of them, they have been here before human beings populated the earth, and they'll be here after us. They can adapt very well, and they know they're resilient. They know they will always keep changing to become more not infectious, but just to give them advantage, because they want to survive as well. And we as human beings are in their environment, we're in their niche, where either from medications we take, drinking water that they live in, many different things that we do, and we put ourselves in that environment. We need to be able to protect ourselves, and vaccination is the main way to do it, especially in our young children. Now, moving on to COVID. COVID is very extremely important because this virus is one of the most transmissible viruses out there. Measles is the most transmissible that we see, because measles, if one person has it in a room, you're sure that at least 10 or more other people in that room will get it as well. It's airborne, it stays up there for a while. COVID, initially we didn't know exactly how it was spread, but we do know that some particles can be airborne and linger for a little bit. And we know that, you're close to people is by droplets. So when you get to people, close enough to people, and you can talk to them, you get these droplets, and then you infect somebody else who inhales it. We can only wear masks. We can't wear masks 24 hours a day. You have to eat, you have to drink. We've been on lockdown for such a long time. People can't survive that way. Human beings are social people. They have to be around other people. It affects people mentally, physically, emotionally, to be on their own. The vaccination, we thank God, came about within, several months, after this virus was discovered. And it is the only way in which we can end this disease. We need herd immunity. The virus will continue. The virus mutates. That's what viruses do. They try to make an advantage for themselves, and they keep mutating and mutating. When most of the time the mutations don't do anything, but they occasionally get some mutations that confer a major advantage to them, either by making them more transmissible or more deadly. And we know that the B117, that's the strain that was seen in the United Kingdom initially, is about 60-70% more transmissible than the wild type that came about in March, that was discovered back in March. And if we do not stop the spread of this virus, if we don't stop the spread from one person to another, it will just keep going and going and going. And it will keep mutating to more and more strains that the vaccines might not even be able to prevent. So we need to get vaccinated if we want to get back to our lives from
normal lives.
December 2019. Yes.
Well, I know in the US, the President Biden has, put in a lot of strategies to make sure that, there's an uptake, by quite a number of people. I mean, done over 100 million in terms of, vaccinations. But now, what's the challenge? I know people of color, particularly people of color, they have challenges, in that area. Can you speak to that?
Well, in the United States, for one thing, the history of the relationship between the medical community and people of color in the United States has been pretty poor since the beginning of the United States. People might not know about this Tuskegee syphilis study that was started, I think it was in the 50s, whereby they were studying black men who had syphilis, and they wanted to study them over time to basically follow the disease and to see how it evolved over time, and then dissect them afterwards to see what happens to the brain, etc. And they didn't tell them that penicillin had been discovered to treat this disease very, very, very easily. I mean, penicillin is the first antibiotic that was discovered, and it could have cured this man. And they did not offer it to this man. They didn't tell them anything because they wanted to study this disease. There have been many things that the United States medical system has done to people of color, for sterilization, even the way that they are treated in the medical institutions. You can be a doctor, you can be somebody of means, but you might be treated horribly when you get in because you are Black or you're a person of color. So people of color have a mistrust of the medical system. They haven't been treated well by it. They've been used as research guinea pigs, and when they go into the system, they're not treated very well. So why? Obviously, people will have questions about going in to receive a vaccine or anything because they don't trust what they're telling them. And that's why it's become a major, major issue. There's also a lot of misinformation in the United States and around the world. Nigeria, where we come from, I've had to talk to many people to try and debunk several ideas about what this virus is all about, what the vaccines are about. There's been so much talk about it getting into your cells and causing long-term effects, and I mean, all these things are not true. So, but they are more believable to us as people of color and as people in other parts of the world because of the history of what has happened, not just in the United States, but in other parts of the world as well. So that's the challenge we face here.
Now, thank you so much for being authentic. I mean, there are quite a number of people listening all over the world and listening to you. You are not just uh, you know the average doctor, but this is your area of specialization, infectious diseases. And in that area, being able to establish yourself. I just want to salute you and celebrate you. Now, I want you to speak on this long-term COVID. Some people have side effects of, maybe, long-term. Can you speak to that? I'm not a doctor, but can you just, in layman's language, yeah.
Yes, long-term COVID, or we call it post-acute COVID syndrome or post-acute COVID symptoms, and we call it long COVID basically. And just to, as a brief definition, long COVID is the term that is used to describe symptoms that persist for at least 4 weeks after your acute infection with COVID. Now, some of these symptoms might be due to COVID itself, and some of it might be due to just the effects of being sick and hospitalized with COVID, such as being in the intensive care unit for weeks or months, not moving because you're on a ventilator. So you have post ICU syndrome. But COVID itself some people who have had COVID itself have been noted to have these symptoms that can linger 4 weeks after COVID, your acute COVID infection, and they could last for weeks or months in many cases. Now, people who get long COVID do not necessarily have to have had a severe illness. In fact, most people have had mild illnesses or have been asymptomatic. People could have fatigue is the main one. I experienced fatigue, a lot of fatigue, where I wasn't sure whether it was COVID or whether it was from the kids or whether it's from work, but fatigue, where people feel they could sleep all day. Have body aches and pains, shortness of breath, cough, some neurological symptoms. You feel dizzy, you have a brain fog, you're not really concentrating, you don't remember things. Other people could have fevers, chills. There are other symptoms that you could have after COVID. Now, we don't know 100% why some people have these symptoms and others don't. We think maybe I don't know, it could be even up to 25% of people that might have these lingering symptoms of COVID after their acute infection. But we don't know 100% why. What we do know is that COVID affects almost all the organs in the body.
Wow.
It affects your heart. Definitely, you have people who've had heart attacks and they say, oh, I had a heart attack. He had a heart attack, so it wasn't COVID. If they didn't test him for COVID and he wasn't really at risk for a heart attack in the past, as far as I'm concerned, he had COVID, whoever it was. And it affects your heart, it affects your lungs. It causes a lot of inflammation. That's the damage that it does. So it causes inflammation everywhere. There's also a syndrome called multi-system inflammatory disorder. It was first seen in children in the UK and published, and we've started seeing it in other parts of the world, and we've seen it in some adults as well, whereby this is after their infection. They didn't even know they had the infection, and then they come back very sick. Their body is sort of fighting itself, and a lot of them end up in the intensive care unit on a ventilator. Most of the kids who have it or who have had it survive because you just need to treat them and maintain their lungs. But the bottom line is, when you have COVID, acute COVID, it is not just a mild infection in a lot of cases. It does damage to your body. We don't know everything about it, but we know that people have these lingering symptoms, and even people who do not have lingering symptoms might still have some underlying issues going on that might not be found out for years. So the best thing is not to get COVID in the first place.
Now, I want to speak to this because there are quite a number of people that, they feel that, look, they're not going to take the vaccination, and they'll do, take a lot of, steaming and hear so many things, and I said to someone, how long are you going to, continue with steaming? Can you speak to that? Is it effective?
No, the only things are symptomatic treatment, like when you have the flu or you have a bad cold, like me, or you have malaria. There are things you take. You take Tylenol, you drink water, you eat pepper soup or chicken soup to open up your sinuses so you can breathe better. These are things you do to make yourself feel better, but it's not preventing you from getting the infection, and it's not preventing the consequences of the infection. We've just talked about the fact that it affects many different areas of your body, and you don't even know what it has affected in many cases until a little bit later. Because initially, in the first couple of days, the virus is just replicating, and then it can go on to an inflammatory stage where it causes inflammation in so many different parts of your body, and that's when people end up in the hospital, because now it's not the virus doing it, it's the effects of the virus that are causing you to be sick. So people can do a lot of symptomatic treatment. A lot of people have also been talking about ivermectin, which is a bit controversial because that is what is available in a lot of parts of the world, because people do not have effective treatments like we might do in the United States. Not that we have great treatments for COVID in general, but at least better than in some other developing countries. So a lot of people have been taking ivermectin because there have been some studies that have suggested that it works. The problem with the studies is that some of them are not big enough. They don't have enough evidence to show that it actually works in so many different people in so many different parts of the world. If they didn't take anything else, because people are taking other different medications while they're taking the ivermectin, and because people are taking it all over the world now, we don't know if it really works or not. So I say that if you're not sure of the therapy, then you get vaccinated so that you don't get it, or if you do get it, it is not severe, so that you don't get sick and you don't have to use ivermectin, or anything else in the treatment.
Okay, awesome. If you're just joining us tonight, I've been speaking with my friend and my sister from Minnesota, United States. She's an assistant professor of infectious diseases. Name is Bosola Akinsete, and she's been adding so much value. I just want to celebrate you out of your busy schedule. It's such a privilege having you on this platform tonight. Now, I want you to speak concerning the different types of COVID vaccines. We have AstraZeneca, Johnson & Johnson, we have Pfizer, we have Moderna. Can you speak to, because in the UK, I mean, obviously, they've had AstraZeneca and a lot of people have had the privilege to take it, but there's also been the side effect of blood clots. People are a bit apprehensive. Johnson & Johnson, they were supposed to come up with a lot of vaccines. They had some challenges in the manufacturing side, So can you speak to it, please?
Yes, of course. In the United States, I'll just say that in the United States, AstraZeneca has not been approved yet, exactly. So I don't have like 100% of information, but we do know some information about it. As a matter of fact, in my hospital was one of the main sites in the United States for testing this vaccine. So at my institution, a lot of people were involved in it. In Minneapolis, Minnesota, a lot of people were involved in the trials. Now, the mRNA vaccines, that's the Pfizer-BioNTech vaccine, as well as the Moderna vaccines. People were concerned or have been concerned about how fast this was developed. But I tell people that, this was a technology that had already started in the past. They had been trying to use it for other infections such as influenza, Zika, rabies, Ebola, actually, in the past. What it entails basically is getting sequencing the virus, so you get the whole virus itself, and then you just take a small piece of the virus, which is the spike protein, in this case in COVID, because that's what it uses to enter the cells of the humans. So what they do is that they get a code from that. And the code helps you tells your cells to make the spike protein. And so what the vaccine is injecting into you is basically that code that is telling your body, there's something here that you need to make the protein too. So your body starts to make the protein of the spike protein, and then it makes it and brings it out and covers the whole cells with it, right? It doesn't get into your DNA, it doesn't get into your nucleus, it's just on the surface. And once it gets into the cell, the code degenerates, and then your body takes over. What happens is that when your body sees the actual virus in the future, because your cells have been primed. They're now very awake and alert that there's this protein that is not supposed to be there.
Yeah.
They attack the virus right away and prevent infection. So it had been going on for a long time. They hadn't found a way to stabilize it yet, because the body's immune system always tried to kill it, but they now found a way to stabilize it. So as soon as they knew this COVID virus, they managed to get all the sequences. The Chinese made that available at the beginning of the year. They were able to just incorporate this quickly into a vaccine, and basically be able to, make up the vaccine very, very quickly. People have been concerned that it was too fast. They cut corners. They didn't cut corners. They knew exactly how this worked, and it can be magic. It can be synthesized very quickly and very easily. It can be adjusted very easily. So those are the two mRNA vaccines. Now, AstraZeneca and Johnson & Johnson are similar, but they are not using your own code to make those proteins. They come in there's a vector, something that is used to help them to get into your cells, which is made out of the cold vaccine, the cold virus. In the case of AstraZeneca, I think it's the chimpanzee adenovirus, and then the Johnson & Johnson is just the regular cold virus, and it gets into your cells that way, and then helps your body get the instructions to make these spike proteins. I'm not exactly sure. Right now, we're not sure what the significance of those reports about this what we call thrombocytopenic thrombocytosis, which is basically your body is forming some clots. Yeah, they've only seen it in young women, women less than 50, in a very, very small number of women, very small number of people, considering millions in the world that have been vaccinated against this. But obviously, you don't want to ignore anything. It was something that was never seen in the trials, and it's almost like an antibody. Your body is sort of fighting your body starts to fight the platelets. It causes your body to sort of fight your own platelets and cause your platelets, which help you to clot, to go down, and paradoxically it causes you to form clots as well. So I know in some countries they have decided not to give it to people who are women of a certain age.
Yeah, but even in Germany, yeah.
Yes, yeah. And I think in I think in a couple of other countries, maybe the UK as well. Yeah. But I mean, with the numbers are extremely small, and what we say is, when people ask what is the best vaccine to get, is the vaccine that you can get into your arm right away. It doesn't matter, in my opinion, whether it's the AstraZeneca or the Johnson & Johnson, Pfizer, BioNTech, or Moderna. You can look at your risk factors and try to determine whether you are at risk. If you are a doctor and AstraZeneca is what is available to you, and you're out of the front lines, you have to look at the risk versus benefits. What are the odds of my getting any clotting issues, and what are the odds of my getting COVID and getting sick from it? And then you make that decision. But if one is not available to you, then obviously you can get something somewhere else. But the quicker you get vaccinated, the better. And there's still a lot of research going into place. We don't know why, and it might be just something as simple as some other thing that that group is doing. I don't know, birth control. I don't know. We just don't know. There's a lot of conjecture right now. But okay. I would say get the vaccine if you can, whichever vaccine you can get.
Awesome. Now, countries are trying to open up. I know in the States, there's been a lot of opening up and closing up, and now regarding children, I know that Pfizer has come up with a vaccine for children ages 12 to 15. Can you speak to that?
Yes, they actually applied for an expanded authorization on Friday to be able to vaccinate children between 12 and 15. Right now, it's approved for people 16 years and older, and Moderna is 18 years and older. And Pfizer has now gotten this, applied for this emergency use authorization to give kids 12 to 15 years. I would say that this is excellent, because everybody has been worried about their children, especially school-age children who are not very young kids, but they are, they have adult behaviors, and their physiology is like, adult-like. So if they're able to get this in place, it would be wonderful, because kids could get vaccinated before the next school year. and then people can go back to regular schooling and not have to worry so much about distance learning. We don't have anything now for children who are less than 12 years old, but there are studies that are going on, and I'm actually going to see what I can do to enroll my children. My children are younger than 12 years old in some of these studies if I can find them, and that's how much I believe in the vaccine. It is.
Well,
Absolutely.
yes, you're saying this because you're a doctor. I mean, I'm sure there are some of people on the platform and say, no, I wouldn't allow my children.
I know that, but I'm trying to say that I believe in the vaccine so much, especially the Pfizer, which I know more about because I've been giving it, and that's what I got. I would absolutely give my children in a heartbeat. So if people see that I do that and my children are fine, well, maybe more and more people will be able to get their children in the studies, and if that's approved, I would say, go on and do it. The more people who are vaccinated, the better. But I understand. I know when it comes to your kids,
Now, I just wanted to speak to this. Again, I have to talk about how can we encourage not just people of color? How can we encourage people to take these vaccines? Because people are it's still a very fluid situation. Can you speak to that?
Yes, it's a challenge. It's an absolute challenge. I mean, you're right. It's not just people of color. People of color, we've talked about how, in the United States in particular, the mistrust with the healthcare system. In other people, who are not people of color, they have the messaging has over the last year has been bad. It's been politicized, which should never be. Healthcare should never be politicized, but it's been politicized, and people are like, well, I'm going to look after my body. It's my own right. I don't know the long-term effects of this virus or the long-term effects of the vaccine. And we don't want to, you can't just dismiss people and say, oh, they're ignorant. They don't know what they're doing. They don't know what they're talking about. I think a lot of it has to do with information, getting people that information for them to make their minds up, letting them know why the vaccines were created so quickly, what the virus does, how do you evaluate your risk versus benefit, and what the consequences are if we are, as a world, as population of the world, are not we don't achieve herd immunity, the fact that it will just continue. In places like Nigeria, where I know I made myself very frustrated over the last year. Every time I went to social media, there was a party, there was a funeral, there was a wedding, and there were people, around without masks and things like that. And they said, well, we don't have it in Nigeria. Nobody's dying. Nobody is this and that. And it bothered me a lot because I know that the virus is not discriminating against Nigerians. It's not saying that, I'm not going to infect Nigerians, but I'm only going to infect Americans or people from the UK. There was something, obviously, we don't know 100% why some people, the infection hasn't been, the pandemic hasn't been as bad in some countries in Africa. Some of it might have to do with the age of the average.
Is it the prayers in Africa?
Maybe the prayer, but I'm sure people pray in other parts of the world too.
I'm just kidding.
I know you're just joking, but prayers help anywhere. But I think the ages of in Africa we're younger than people in the Western world, because people die a little bit early of infections and other things. They can't get to the hospital, etc. So our average age in Nigeria, for instance, is like 18 years old, whereby the average age in somewhere like China is over 30. And so we know that younger people do not get it as bad as older people, but it doesn't mean that they're not carrying the virus and it's not spreading to other people. We also, a lot of people are just outside all the time. Windows are open. Maybe that's a factor as well. There are things that have been looked at, but the bottom line is we threw a lot of caution to the wind in Nigeria. And a lot of people had a lot of big social events, and people died. So it took that to make people pay attention again. And I think that's all we can do. We can only give education. We can, I tell people that when they get vaccinated, they should put it on social media, tell their friends, their family, their colleagues, because the more they see people getting vaccinated, the more likely that they will get vaccinated, right? Because they've seen this person and this person is doing just fine. So why can't I get vaccinated? We take information out there to people where they live, and not assume everybody's going to watch social media. Go to churches, go to other groups where people can help you to disseminate the message to their own congregation or their constituents.
Okay, someone has a question here. It says, how does the vaccine work in the case of people who have had the infection before? Aren't they meant to have developed antibodies as a result of previous infection? Can you speak to that?
Yeah, you see, the thing about it is that, again, this is a virus that we don't know a lot about. What we do know, what seems to be the case, is that once you get infected, right, you seem to have immunity for at least 3 months, possibly longer in some cases, but at least 3 months. After 3 months, all the bets are off. Can you get vaccinated? Can you get infected again? It's certainly possible. We haven't seen reinfection is pretty rare. When you look at the millions of people who've been infected in the world, reinfections are extremely rare, but it happens. And now that we have different strains, it's actually possible and likely that some people who get infected a second time might be infected with another strain. These are, I know now in Minnesota and all over the United States, if you see somebody who has a breakthrough case, either being reinfected after they were infected like over 3 months ago, or they've gotten vaccinated and they get infected again, then we have to send it off to see what kind of strain it is and what's happened. But antibodies are not, everybody develops antibodies differently. Your immunogenicity is what we call it. You might develop very strong responses, and we've seen children tend to develop very strong antibody responses. Maybe that's why they don't get as sick, but not everybody develops it the same way. And antibodies are not the only factor in terms of fighting this infection. There's also another type of immune system called the cellular immune system, basically. So everybody is different. What we do know, though, is that the vaccines elicit a much stronger immunogenicity than the infection itself. Your antibodies are higher when you're vaccinated than when you get an original infection. So more to come. We've only had like just over a year of having this as a global pandemic. A lot to learn, but we know that reinfection is possible. Seems to be rare now, but that's one of the reasons why we say wear masks. There's so many different things that we don't know.
Awesome. Bosola, you've been adding so much value tonight. We celebrate you and we honor you. If you just joined us, we've been speaking with Bosola Akinsete. She's resident in Minnesota, in the United States. She's an assistant professor of infectious diseases, and we're speaking tonight on leadership and COVID. Now, I want you to speak to this. I think it was about a few days ago, and a particular lady who went on holiday, I can't remember the country now, said she was vaccinated, but she still got infected.
Yeah, and that's what I was that's what I was alluding to towards the end of my last sentence there, saying that these vaccines, we know that they're not 100% effective, right? Even with the Moderna and Pfizer, that about 95-96% effective against infection, although they seem to be closer to 100% effective against severe infection leading to hospitalization and death. But there's still that 5%, and if you have 1 million people, 4% is a lot of people, so you can still get the infection. You can still probably have a symptomatic infection, because I think that's what happened with that person. She tried to get on the plane and she tested positive, even though she had tested negative in the interim. So it's very, very possible to get that. We know that it is nothing is 100%, and we have to use other public health mitigation efforts to try to decrease the spread of this virus.
Okay, excellent. Well said. Now, I just want to speak to this. What's the role of leadership, in creating awareness? A situation where you have some governors are saying, you shouldn't wear masks. Some are saying wear masks. Can you speak to this? What's the role of leadership in ensuring, we can, arrest COVID?
Yeah, very pained look on my face, because it's something that has been very, very painful to watch as infectious disease doctors. Leadership is critical. I mean, past leadership in this country, I think, bungled a lot of this effort, and which is why we allowed this virus to spread and affect so many people so quickly. Now we have different leadership. Everybody's going to, nobody's going to do everything 100%, right? But I think one of the most important things is listening to the experts. Listen to the experts and getting people from different areas who have expertise in different areas that can help you. The experts know the research. The epidemiologists know how it's spreading. You have people who are in communication. You have technology people. You have religious leaders. You have people from different ethnic groups or different races, and they come together and come up with something. I've been impressed by the current president's efforts, and also my organization, Health Partners, has done a great job in terms of trying to get this information out.
Well done. Well done.
Wonderful. And one last thing is that you have to be able to adapt. New information is going to come out about this virus. You can't say, oh, you said this then, so I can't do it now. You need to change and adapt it. If this is what it says, then do it, and say that you didn't know before, but now you know, so do it. I think humility is the name of the game from anybody who is involved.
Wow, awesome. I just want to thank you. Now I want to ask a very, it's a tricky question, so I'm not trying to set you up.
Okay.
I want you to listen attentively. Can COVID be eradicated?
That's a very tough question. I actually don't know. I don't know if anybody knows, because again, there are some viruses that have been eradicated, right? Smallpox was eradicated, polio has been eradicated, but I don't know the way COVID is very, very transmissible. We have asymptomatic infection, whereby you don't know somebody has it, and so that person can send it to you, can give it to you. And again, if we do not have a herd immunity, if about 80% of us in the world are not immune against it by vaccination, mostly, I don't think we can eradicate it. It's going to keep mutating, and it's going to keep finding a way to get by vaccines or medications that we use against it. It might become seasonal, like the flu. In the the influenza changes every year. That's why you have to get vaccines every year. It shifts a little bit every year, and then you have to put another vaccine for that year. It's possible that COVID can become that way, but we might have enough herd immunity that the virus will just peter out, maybe. But I'm not confident.
Okay, there's another question from a friend of mine who's going to be speaking on leadership and talent management next week. His name is Dr. Iyo Udueni. Is speaking, asking this question. It says, "Are you concerned that some leaders are anti? Is it anti-vaxxers? And if yes, what is your advice to leaders who are pro-vaccination in terms of tackling the rhetoric and misinformation coming from their peers?" Yes.
I think that one of the main things is to try not to antagonize people too much. I think that's one of the things that gets people fired up, other people on the other side fired up, and then they say, oh, it's my right to do this, it's my right to do that. You talk about the benefits of the vaccine, talk about the risk versus benefits, get that information out to even even if it's not the leadership that is talking about it, go to the people where they live, go to the people who are being affected, send people out, talk to their leaders, talk to their sisters, their brothers, their students, their colleagues, and get them to actually one-on-one talk about things, and give them the actual information that they need to make that decision for themselves. Because we know that there's some leaders who are not going to tell us what is real, at least according in the medical world. We know that there were anti-vaxxers in the past who have been against all vaccinations, assuming that, like the measles, mumps, and rubella vaccine causes autism in kids, which is something that has totally been debunked. It is not true. But there are a lot of people who are still behind that, and people are still listening. So I think we just need to break out into small groups and talk to people, go to where they live, and give them the message one-on-one, as opposed to just letting top leadership, control the rhetoric and the conversation.
Okay. Now I want to speak to this. Your constituency, the healthcare workers, you guys, frontline, but quite a number of your colleagues are not taking the vaccination. Can
Yeah.
you speak to that? Yeah.
It had been puzzling to me a little bit. I'll tell you, this happened last week. We have a meeting that we have every week with the Department of Health, Minnesota Department of Health, all the infectious disease doctors in the state, and anybody who is interested. And we were talking about this exact topic. How do you tackle vaccine hesitancy? What are you doing in your institution? What are you doing in that institution? And then somebody called in, and this is a person who is a doctor. We don't know who that person is, but the person is obviously not an infectious disease doctor. The person called in and said, it is my right to do what I want with myself and my body. I do not know what the long-term side effects are of this vaccine. I've seen some people who might have some neurological problems. I've heard about some people who might have some issues. And even though I'm a doctor, it is my right not to get vaccinated. I can just wear a mask and go and see my patients. But somebody said, that's not fair. That person who is seeing you is trusting that you are healthy and you're not going to make that person sick. And she said, well, I can put on a mask, I can do whatever, put on a shield and try to prevent myself from infecting anybody else. But I think that it's easy for me to say it's selfish. But I understand that she has valid concerns. But it's again a matter of information. Talk to people. Don't just listen to what your friends are telling you. Talk to people. It's a challenge.
Yeah.
Yeah, it's still a challenge.
Yeah. Okay. Well, I mean, I promised that you were going to be with us for an hour. We're almost getting to 45 minutes. I just want to thank you for showing up, and
Sure.
even for those who are asking questions, want to thank you for engaging. I just have about 2 more questions.
Okay.
Yes. Just now, this culture of transparency. Can you speak to that? What can we do to make sure that this is transparent, because some people believe that it's shrouded in secrecy, in terms of what is in the vaccine. Some saying that, look, your DNA, and so on and so forth. Can you speak to that for a few minutes? Transparency.
Yeah, that's the most important thing. We have to be absolutely transparent about everything. And that's why, when I'm giving information, I'm trying to tell people what happened and how it came about and why this is being done. And, just give them the information that they need. People think, there's always a conspiracy theory out there. When I see leaders taking the vaccine, when I see doctors taking the vaccine, when I see other healthcare workers and important people taking the vaccine, I'm hoping that people know that those people trusted the information enough and are doing okay. They're in the public eye. We can see that they're doing okay. Then maybe they'll believe. But unfortunately, you cannot cut off social media. The social media is everywhere. They're trying to sort of stop misinformation about the vaccine, but you can only do so much. But explaining and educating is the main way to go. Going to people, and when they ask questions, tell them what you know, tell them what you heard, tell them to look at the data. This is the research data that is saying this and that. And the vaccine companies themselves have to be much more transparent. I think that's one of the issues that has happened with AstraZeneca. I trust the vaccine, but I don't know that they've been as forthcoming with some of the information as quickly as the Pfizer and BioNTech companies came up with that. And so it makes it look a little bit more suspicious. But it's a game
It's an ongoing conversation.
Don't have to keep going. People make mistakes, learn from their mistakes and move forward. Basically.
Wow. Awesome. I said one more question, but I need to speak to this. In a few minutes. Vaccine passports, is it likely to happen?
I don't know. I think it's happening somewhere. It's happening I think it's happening in New York right now. I think that's the only place in the US I know that it's happening, whereby they have to, it's online. It's you show it on your phone, and then only when you've had that those 2 vaccines can you be allowed to go into a game, because I think it was being used for a football game in the United States, in New York. But I don't know. I think personally, I think it should be. And if you're not using it, then you should need to have an exemption of some sort, saying I can't get it because of, I have a reaction to this or something, But people are going to say that it's my right to do what I need to do, and I don't need to show a passport to say that I can go here or I can go there. So you're going to have a lot of arguments against that because people believe in freedom, and their civil rights, and they don't want that trodden upon. But I do think it's going to happen. I'm sure there are people that are not going to be allowed to go on a plane if they don't have a vaccine. There are going to be people who are not allowed to go into some certain institutions, like going back to school. They're using it in some colleges now in the United States. If you're not vaccinated and you can't show that you've been vaccinated, then you don't come back to school.
Wow.
And I think it's going to take hold in other places.
Wow.
I think it should.
Wow.
But that's an infectious disease doctor, I think we should.
No, we respect your views, I mean, and that's your field. So we just want to thank you tonight for showing up and adding so much content. And for those of us that are on the platform, I want to say thank you to Omotola. Just drop it in the comment section. Say thank you to her for giving us this invaluable information. Finally, now you are adding so much value. Your knowledge base is so wide. Who are your mentors?
Yeah, I mean, I alluded to this at the beginning. I mean, my parents made a big impact on me. My mom is a doctor as well. She's a professor of hematology. People would know her at the University of Lagos, and she's been very involved in the world of HIV as time has gone on. And I've watched her. I've seen how.
And your dad was also a professor as well?
Yes, my dad is also a professor as well. And in my mom's case, I saw how she blended her family, her life, her career, and she was still able to maintain her life and be a happy person. And wow. I said, I'm going to be like her, And my father also told me that as a woman, or whoever I am, whatever I want to do, I should try and do it. Don't do it halfway, do it well. Both of them made a major impact in my life growing up. And I had a couple of mentors along the way. There was a African-American doctor when I was in my residency, Dr. Valerie Stone. She was very big in the world of HIV, and she sort of just took me under her wing and taught me a lot, introduced me to people, opened up my world, and made me more interested in infectious diseases and HIV. And then finally, when I came to Minnesota, I worked when I was starting out my career. This was actually a white man. He's an older white man, Dr. Keith Henry, and he took me under his wing. He took me out there and said, Bosola, there's HIV going on in the community. You're a Black doctor, you're from Africa, you're interested in this, go out, do this. Introduced me to people, had me go out there in the public eye, and he helped me so much to be who I am today. And I'm so grateful to all those people, and of course to God for making it possible in the first place. Yeah. Wow.
Bosola, you've spoken so well. We're thankful. We just celebrate you. We just want to bless God for your life and what you're doing. You're touching so many lives, and we believe that the sky is is not even the limit. You could continue to soar. On behalf of myself and Leadership Talk with Adegoke, we just want to thank everyone that's joined us tonight and going to be watching the replay. We celebrate you. You have some people here that have been rooting for you. Temilola, is saying awesome, thank you. Yola Shorewek is saying thank you. Quite a number of people. You're much loved on this platform for coming, and I just want to thank you so much. So this is the 31st edition of Leadership Talk with Adegoke, and next week we're going to be having another special guest, Dr. Igo Udueni. He's going to be talking about leadership and talent management. So until next week, by the special grace of God, have a restful Sunday evening. Thank you everyone for joining.
Thank you.